Past Barbara here, filling in for future Barbara. You're listening to the Bright Horse and Hound blogcasts. These are my companion podcasts for my blogs. All the links to the blogs are in the description below, and stay tuned to see what future Barbara had to say. This podcast is very much inspired by a client I saw last week. Though, to be fair, this is not just this particular person. I come across this a lot. But during our conversation, it really made me sit there and think more people need to hear this outside of the people that I see. And basically throughout the session, and particularly at the start as we worked through bits and pieces, but particularly at the start, my client repeatedly said things like, I know we created this problem. I know we did it to ourselves. I know this is my fault. And I know I caused this. And even after I said repeatedly, you absolutely didn't, and I repeated that reassurance several times, I could tell that she still felt she was part of the problem. Now, in her case, she had a previous trainer out who used very aversive and unkind methods with her dog. And unfortunately, this is something that I see quite a lot because I tend to follow them round, because we know that aversive and unkind and unethical methods are more likely to create more problems when we're working with our dogs. And unfortunately, the people who tend to use those don't use ethical science-based methods when it comes to dog training. And those people in and of themselves tend to be more aversive, not only to the dog, but also to the client and the dog owner. Because they're not coming from the same level of compassion, because they don't have that understanding in behaviour and psychologies. There tends to be a tendency, too many tends, to tell owners in these cases that they're the ones to blame, that they let their dog get away with it, they're the root of all evil and they caused the problem, and if they'd only done things differently, then the dog wouldn't be behaving this way. And I'm here to tell you very clearly that that isn't true, and it doesn't stand up for anything that we know about behaviour and behavioural psychology. When we're faced with behavioural problems with our dogs, it's really, really hard. It's really overwhelming. It's really stressful and frustrating. And also, it's very isolating. We already have a tendency to blame ourselves for causing the behavioural problem in the first place, but it's often a lot more complex than that. It isn't just one finger point at you. But I get it, because if we have a reactive dog, if we have a dog with separation-related behaviours, if they're growling, if they're destructive, they're snapping, or we're struggling, we can often look outside and see that everybody else seems to be coping fine and start to think, why is it just me? Because you'll know someone who has a dog and it all just seems super easy for them. Or maybe you had a dog growing up, or you knew a dog when you were younger and that's what made you want to get a dog in the first place. And now you find yourself wondering why your dog isn't like the memory of the one you had as a child or the one that you grew up with when you were younger. And that's when the blame starts to creep in, and we do it to ourselves anyway, because we sit there and think nobody else seems to have this issue. It really does feel like it's just me. So then naturally people start to think that they must be doing something wrong, or that they did something wrong to create the problem. Enter in an aversive trainer who's not very empathetic and doesn't have an understanding of behavioural psychology or good psychology, who then tells you, you let the dog get away with this, and it confirms all your fears. The thing I would like people to really take away from this podcast, and something that I say to my clients all the time, this comes up so much, research backs it up to, you are in fact in the majority. You're not in the minority, it's not just you. There is a minority of people who sail through puppyhood, adolescence, and into dog adult life without any behavioural challenges whatsoever. But they are the minority. And I can tell you now that there are plenty of behaviourists and trainers who work really hard to train certain behaviours and work through all these behavioural things, and yet some of us and most of us still tend to have dogs that are potentially reactive or anxious or sensitive, or struggle with separation related behaviours and other issues, because behaviour is complex. So you are in the majority of people, because the majority of people have behavioural issues at some point with their dog, at some point in their life. They are very common. They affect dogs of all breeds, ages, sizes. And the research shows up that a very high percentage of dogs experience a behavioural issue or behavioural problem during their lifetime at some point. So again, you're not alone and you're in the majority. And a lot of these problems also put a real strain on the relationship between you and your dog. Many clients describe to me that they feel like they're dealing with Dr. Jekyll and Mr. Hyde. One minute the dog is lovely and affectionate and the best dog in the world, and the next minute something happens, they suddenly snap or bark or lunge or panic, or they react in a way that seems completely out of the blue. And in the same breath, people often start to reflect on their own capability as an owner. They wonder why they didn't stop it sooner. Why can't they be in control of the behaviour? Why can't they do it? Whether they start to wonder whether they've done something wrong when the dog was younger, or, somehow they did something to make the problem worse. And when we get Dr. Jekyll and Mr. Hyde situation, where a dog is lovely and amenable one moment and then suddenly changes, there is often something else going on. The out of the blue tends to be a lot of things like pain, discomfort, fear, stress, anxiety, or a medical issue. There's some underlying cause that no amount of training in the world was ever going to fully resolve on its own. So again, you were never to blame. And I think that's why getting the right help really matters. And hopefully when you bring in an expert, there's someone who can point you in the right direction rather than make you feel worse. And ultimately, that's how I work. I look at the root cause, I use ethical science-based methods. I consider the medical side of things, like involving your vet where needed, so that we can support your dog and you properly. The client I mentioned at the start of this podcast, which inspired me to write it, and you can read the blog as well. At the very start of the session, as I say, she was very, very much blaming herself. And during the session, it became very clear to me that there was an underlying discomfort, which we later found out was a luxating patella. As I said to her, all of the training and management she'd already did not cause that problem. The dog was reacting and behaving that way because there was an underlying medical condition. And in many ways, the things that she actually did and put in place probably actually helped prevent the behaviour from becoming more aggressive and escalating further. So the steps that she did were actually all the right things. Because she'd already done a lot to mitigate the situation, reduce the stress, the anxiety. She set her dog up for success as much as she could with the information that she had. And once, we could identify the likely root cause of the pain, combine that with appropriate behavioural modification as well as collaboration with the vet, then things started to move forward in a much more positive way. So I really want to say, if you're looking for help with your dog, you're in the majority, looking for, because again, that 76% of people at some point in their life will struggle with behavioural problem with their dog. You are in the majority. It does not mean that you have failed. You means you're actively trying to support them and yourself. You're not to blame. You're not alone. And you're actually, again, in the majority. There's a lot of common behavioural issues that I see in dogs, and I wanted to kind of spend a bit of time going through that in this podcast, just to kind of show you what's out there, and hopefully some of this you'll identify with or you've seen it. Because not only are behavioural challenges, common in dogs, they also show up in lots of different ways. And some of them get grouped together, and some of them need to be handled differently. Some behavioural problems are really obvious because they cause, a disruption in the home, or they make walks more stressful, or they leave owners feeling like they just can't manage the day-to-day in the way that they wanted to or expect it. Or they can't leave their dog alone because the house gets destroyed. Other behaviours may seem sort of like a little quirk at first, but they're, that's just the way they are and part of their personality. And some may not seem like a behavioural problem at all until we start looking, at it deeper and find out what's going on underneath. Like, for example, coprophagia, which is a very common behavioural problem. And this is when a dog eats their own feces or the feces of other dogs. And it's often just dismissed as, oh, dogs are gross, or that's just something dogs do. And yes, it is disgusting to live with, but it's also a sign that there's something else going on. It's not a normal behaviour, and it could be linked to something that we're learning. as a diet, stress, gastrointestinal issues, management issues are the underlying factors. So while on the surface, the behavioral problem might not be what people usually think, and it could be something else that's worth investigating. Another really common one is separation anxiety, and I think it's a behavior that people are really familiar with. However, the term doesn't really capture the full picture, and we often prefer to talk about separation related behaviors because not every dog shows the same signs and not every case is the same. So, for separation related behaviors, they are one of the most commonly reported problems in dogs. They're hugely distressing for both the dog and the owner. Dogs can bark, cry, howl, whine when they're left alone. Some dogs, on the other hand, might not vocalize at all. They might urinate and defecate in the house. Again, going back to the coprophagia, I've seen both. They urinate, defecate, and then eat their own feces. Some of them just might destroy household items, chew doors, scratch basically at the exits. I have seen a dog chew right through like literally a wooden door in the center. It was incredibly impressive. Skirting boards tend to be another one as well, table legs and so on and so forth. And some other dogs may just show quiet signs of distress that you never discover unless you set up a camera, and they just cope in silence. So that's why we don't really call it separation anxiety anymore. We call it separation related behaviors. The other side of these separation related behaviors is they can also become like a legal issue with neighbours, particularly if a dog is crying or barking or howling while you're at work. Owners can complain, councils can get involved, the judicial system, and some of these things can like escalate to a formal noise complaint and actually go into the courts. So getting on top of the emotional distress of knowing that your dog is struggling, there's also a real practical pressure on the owner as well. And it's also one of these problems that can make people feel really trapped in their own home. Like, I often describe it as owners becoming prisoners in their own homes because they don't feel like they can leave their dog, and then they might stop going out. They cut their plans short, avoid social events. They try and arrange whole days around their dog and how their dog can cope. Rather than kind of seeking help and trying to explore that, because again, we go back to that blame. They feel like they created it, so they almost feel like they have to put up with it. I have to do this because this is my fault. And sometimes people will describe it to me as, my dog is very attached to me, and they might not always realize that there is support available there to help reduce the separation related behaviors and reduce that kind of attachment. And that's why we call it separation related behaviors, by the way, because there's a wider picture than one just simple label of separation anxiety, because not all dogs show all those behaviors, and not all behaviors have the same level of difficulty in every home. Like, some of them people may be okay with, some people sort of dismiss chewing household items as chewing is just what dogs do. Dogs just chew. A dog who barks in the garden when they're left alone is just dogs just bark, it's fine. A dog who follows their owner around everywhere they go, they just love me, they're very attached, rather than a dog that's struggling to cope with separation. So it becomes very complicated because what looks like separation anxiety is not always separation anxiety. This is the other thing. I often meet clients who list separation anxiety as one of their concerns and one of the things that, they want me to look at. But when I look more closely, the behavioural issues might be unmet needs, their ethological needs, like doggy needs effectively, pain, skin problems I've seen as well, like dermatological issues, gastrointestinal discomforts of their tummy, or some other medical factor. Or sometimes it is just, a simple case of training and adapting and habituating to be alone. And in a lot of those cases where the owner thinks there's separation anxiety, and I don't believe it's the case, we change a few things and it can make a huge difference. And within a week or two, they are like, there's no separation anxiety. So we can often, as owners, go both sides of the spectrum. We can go, there definitely is separation anxiety, and there isn't. Or we can go, they're just being dogs and there's nothing, and they're actually separation related behaviours that need support. I had a client a couple of months ago who, again, listed separation anxiety amongst their concerns. And when I looked at the full picture, the dog had a dermatological issue, which, I linked above, or I talked to above, which linked to his nutrition, and he actually had intolerance to beef. So once we cut out beef and dairy and we removed that from the diet, we changed the nutrition, the skin issue basically resolved and disappeared, and so did the behaviours that the owner had associated with separation anxiety. So it doesn't mean that the separation anxiety that the owner, recognize was never real, or it doesn't mean that it's not real at all. That we're still isolating that there is an issue there and a behavioural problem, and it really is absolutely something that can become very serious if we don't action it. But it does show why we need to look at the whole dog rather than just assuming that every case fits neatly into one of these boxes. And it's important to understand that separation anxiety or separation related behaviours are really influenced by genetics, breed, predisposition, early learning, attachment routine, attachment theory, it's a whole separate thing, changes in routine, previous experiences, unmet needs, so that's your doggy needs and ethology, their health, as I've talked about, pain and underlying medical issues, and also their environment and their setup, and how comfortable the dog feels left alone, again, the environment and the management that's there. So it is really complex, but it's also very common. And the same is true for other behaviours that people contact me about, such as aggression, growling, barking, destructive behaviours, fearfulness, reactivity, resource guarding, toileting inside the house, food-related behaviours, handling difficulties, obedience and training. Some of them could all be rooted just in fear. Some of them could be linked to pain and health. And some could just be frustration, the behaviour and stress and learning history, lack of appropriate outlets, as say those doggy needs that mean that the dog is not being able to cope in that situation. And that's why understanding the behaviour matters so much rather than just labeling it. We need to figure out what's actually driving everything underneath. And that's why it's important to get the right expert to do that. There's two other things that I want to discuss here as well, common issues that I see. And this is probably another heavy hitter along with the separation related behaviours, and that's aggression towards people and aggression towards other dogs. And they tend to be the majority of my caseload because they're quite scary when they happen. And as I say, there's, legal and judicial and civil, repercussions that, as part of the Dangerous Dog Act that we need to be able to be responsible for in our society. We generally refer to them as aggressive behaviours, and I'll continue to refer to them that in this just for the ease. But it's also something people describe as, dominance, stubbornness, bad manners, or the dog trying to be in charge. Sometimes people will describe it that way. None of those are actually an accurate representation of what's happening. And what we as behaviourists will actually, refer to it as, we would call it distance increasing behaviours, because the dog wants to increase distance away from whatever the trigger is, whether it's another dog or a person. And that is more accurate than aggressive, because aggressive, implies an emotional, a side to it, that there is intent there. And the intent is actually not about being an aggressor, but actually to increase distance. But for the sake of this, I will probably refer to it as aggressive, just so everybody understands. But basically what it means, in other words, the dog is really trying to just create distance between themselves and another person or another dog. And for the purpose of this section, as I say, I'm just going to talk about people and other dogs, although there is differences between, stranger danger, where dogs don't like other people, or dog on dog, where dogs don't like other dogs. Because ultimately, not all dogs like other dogs, and not all dogs like every person, and that's okay. But if a dog is showing aggression or aggressive behaviours towards a person or dogs, again, it can become a really serious concern. When it comes to people, I often refer to it as stranger danger, because there's an element of fear involved: barking, lunging, shying away, avoidance, growling, snapping, barking. Generally tends to be a lot of avoidance behaviours or trying to hide. And they're all ways for the dog to try and communicate that they're worried or uncomfortable, or trying to keep themselves ultimately safe in their minds. And these behaviours are rooted in things and linked to fear, anxiety, and stress. They can also be what we call associative learning, where the dog has learned to associate a person or type of person or another dog with or a particular situation with something scary, sometimes painful, uncomfortable, or unpleasant. And sometimes that learning is very obvious and you can see where that's happened. Other times we may never know where the association started. It can be sometimes very difficult to unpick that. The reason we have to take these behaviours really seriously is not only because they're scary, absolutely, as I alluded to earlier, there's legal implications. If a dog bites a person or bites another dog, there can be really, serious consequences from the state. And people can also take individual legal action. So it's really important that these behaviours are managed carefully and ethically so they don't escalate. A lot of dogs do present early warning signs before they snap or bite. They may, stare, freeze, move away, growl, bark, lunge, tension in their body. There's things called calming signals and early indicators of stress, or just really try and avoid the situation. And how we respond to these early signs really matters. Sadly, again, going back to aversive trainers, a lot of aversive trainers will still tell owners that the dog is trying to be dominant and the behavior needs to be punished. This is 100%, 1000% the wrong approach and will and most likely make the situation even worse. So the reason, and more dangerous, like importantly. So the reason I say it is if we punish a dog for growling, or if we punish a dog for barking or lunging, so we might yank on the rope around their neck or their collar, we might give them a smack them on the nose, we may be stopping that behavior from happening in that moment in time. But what's really important is the behavior is communication. Again, the dog is trying to communicate, I would like distance. And if we tell the dog that it can't speak anymore, and the dog is trying to tell us that they were uncomfortable and they need distance, and we remove that communication without changing how the dog feels about it, we end up with a dog who no longer growls and barks. You think, great. But now it's going to go straight to a snap or a bite because we've removed the other rungs of the ladder that go up. So there's a ladder of escalation. The dog might avoid, may avoid you, may shy and move away. Maybe then if you grab the dog might growl or bark. Then they might lunge, then they might snap, and it's an escalating ladder. If we start removing all of those lungs, the dog has to jump right up to the top. So if we end up punishing it or use aversive means, we are more likely to make the behaviour more dangerous. And there's also an issue of associative learning. So every time the dog sees a stranger or another dog, so if we're out walking them and when they're puppies, they want to get to somebody else and they're barking and they're jumping and we pull on the lead, we punish them for that reaction. So what happens is they look at that stranger, they look at another dog and then they associate something unpleasant happening, being pulled on the lead with that other dog. So instead of helping the dog feel safer, we're using punishment, even if it's accidental, and we're creating fear where it never, lived before. And it'll actually make the reactions happen more likely, in the future. So the research shows us that about 19% of dogs display some form of aggression to other animals because, as I say, for the purpose of this, I'm talking about dogs and people. But there are other animals that dogs will react to. We have, I say, sheep, other, poor squirrels, birds, there are other animals that dogs can react to. Dogs and, I say, humans at some point in their life. And these behaviours are, fundamentally a lot of them are rooted in fear, stress, lack of appropriate socialisation. That is a big factor. Previous experience, I talked about the associative learning. Genetics and breed tendencies absolutely do have a factor. And very often, a lot of the time, there's an underlying medical issue or there's pain. Because ultimately, if the dog is sore or uncomfortable, or they're worried about something, they're worried about being touched and approached, or jumped on by another dog or touched by another person because they're uncomfortable or sore, they show distance increasing behaviour to try and protect themselves because they're uncomfortable. And from the outside, we turn that all as aggression. But from a dog's perspective, they may simply be just trying to create space and make themselves feel comfortable. It doesn't mean that we don't need to take the behaviour seriously. It is serious and does need to be managed properly. But if we just label the dogs as aggressive or dominant, we totally and utterly miss the opportunity, to be able to figure out what's happening with the behaviour in the first place and manage it correctly. Another behaviour that I see a lot, I won't dive into it here, but if you want to go and check out my blog, maybe I'll do a podcast on it later, is barking and excessive barking, because dogs aren't vocal communicators, which means they're primary. I'm a vocal communicator, so are you. Like, you're listening to this podcast, all of it is done through words and vocalization, and humans are very vocal. And so are other animals, but dogs actually aren't. They're quite silent communicators. So, I said the blog is there if you want to go and listen to it on the web or read it on the website. And at some point, maybe I will manage to get it into a podcast. So the last behaviour I want to talk about, which is one that I get called out to a lot and is very common and kind of links into, the two I've already touched on, but sometimes it's not related to them, is, destructive behaviour and chewing, and also, pica. So I know destructive behaviour and chewing kind of come to the same in some ways, but they tend to be like the dog destroying the house training issues. As I have seen a dog chew entirely through a door. That was very impressive. I've never seen anything since. And I'm talking about the centre of the door, by the way, like literally like in the middle, like just above the door handle, right through the centre. Like those, you could crawl through it. It was that big. It was very impressive. And as I say, like a lot of these behaviours can overlap. That's why I've left this till last. So hopefully it'll make a little bit more sense with other behavioural problems. And again, they tend to get dismissed as, but dogs just chew things. That's just the way dogs are. And yes, dogs do chew things. Chewing is a really normal behaviour for a dog. But chewing a non-food item, so your slipper, your skirting boards, the door, is not something we should dismiss as normal. Dogs don't want to eat something that isn't edible. Edible foods is carrots, pig's ear, like the steak, your food. They're edible items. Like they are food items. So when dogs do chew furniture or they tear apart household items, I've seen, again, dogs destroy an entire sofa and drag it from one side of the room to the other while they slowly tear it to pieces. Like, again, destruction of furniture is something that I get called out for a lot because, number one, we buy nice things in our house and we like to keep them, and they cost money and we've got to replace them. Number two, also when a dog does ingest them, it can actually have serious medical implications for them. We have to get their stomach pumped or induce vomiting, or in serious cases actually have surgery. So it is really, really important. And I've seen some, I say the door, the sofa, what else I've seen skirting boards being ripped off completely. It's an incredible the amount of destruction that can take place. And when dogs do that, or they even like they eat their teddy bears, I say skirting boards, they ingest things that are not food. This is a behavioural issue known as pica. So pica is where dogs eat or ingest. So they, actually, not, they're chewing it or eating it. They're actually swallowing it. Inedible items. So that's, again, non-food items. So, I think we'd all agree that your sofa is not something that you want to eat. It is an inedible item. I see a lot of dogs where, as you say, they have destroyed so much in the house, or I can, see them eat it, as I say, and having to explain to owners that no, dogs naturally don't want to eat things that are inedible, because we sort of assume, oh, but dogs chew things. So when your dog is repeatedly chewing and ingesting a non-food item, it's an indication that there's something else going on, either from a health perspective, like behaviour, their ethology, or their well-being, their emotional state. There's something else going on. And it may be that their needs are just not being fully met. It may be linked to stress, frustration, boredom, anxiety. Gastrointestinal is a big one. And that makes sense because, there's something going on. They've got an intolerance, or they're not comfortable in their gut, and they're trying to figure out something that's helping, or there's nutritional issues, or there could be some other underlying medical problem. And usually the two of them go together. There's something gastro and then something else going on. In a lot of cases, I also see this alongside coprophagy. I know I spoke about this at the start of the podcast, And this is where a dog eats their own feces or the feces of other dogs. And again, when we see something like they're eating inedible items, again, poop is part of that too. They're eating the sofa and they're drinking their own urine and eating poop. Then again, really kind of links to some kind of gastrointestinal tract. And it's one of the reasons I take this really seriously when I see pica and destructive behaviors, because it can also be linked to resource guarding. So, if your dog picks up something or is eating an item, and that could be maybe that could probably make them sick. So like they're chewing on their teddy bear and they ripped all the stuffing out and you're going, I need to take this off them because, they could be sick and it might cause a blockage or require veterinary intervention. You naturally want to try and take those items away. The problem is for that dog, it's become really important for them. So we keep trying to take it away. And if we don't address why they're eating it, if we just go, oh no, you can't eat that, we keep taking it away, what happens is we keep repeating that. And then the dog starts to learn to guard that item. They run away with it. They swallow it quicker. They might growl or snap and protect it and become more defensive. And then on top of the destructive behaviors, the fact that we've got potentially like something more serious happens when they eat it, we also then can get resource guarding, and that can be really hard. And then we've got several behavioral problems that we unpick. And a lot of the time, yes, I say if it's big items like, as I say, I mentioned the sofa and the door and all the rest of it, people get me out for destructive behaviours. But, it does often happen that we're straight into a resource guarding issue. And if we walk it backwards, then we usually find out that, yes, we've had these chewing, yes, they've been eating this, and you can see the train that it happens. So, please don't think, oh, my dog just chews things, that's fine. It does need to be investigated because it can escalate, much sooner. And I've had dogs who get very, very, very good at resource guarding, like to the point where it's actually terrifying. Like when they will grab an item and within 5 seconds they will gobble it down, and then we're running to the vet to have to try and get their stomach induced vomiting and stomach pumped. And it is not a nice thing to have to do for your dog or for you. And I would say that, again, if we go back to the research, again, remember you're in the majority, like these behaviours start to add up over time. Studies have shown that over 30% of dogs who engage in some form of destructive behaviour, at some point in their lifetime. And this is adult dogs outside of, puppyhood. I'm not talking about kind of your teething and all the rest of it. Again, that we're talking about kind of adult dogs. So just because it's common doesn't mean we need to ignore it, because I want you to be very careful about kind of thinking, but dogs just chew things, and leave it at that. Yes, if a dog is chewing something and it's an edible item and an item that they're going to eat, and it's a lovely, it's a carrot stick or a rabbit ear or a pig's ear or something nice that they're actually going to eat and chew, fantastic. If it is not a food item, we need to investigate why that's happening and look for a better way to support them. And if we don't, the problem may continue, escalate to resource guarding, and we want to stop it from developing to resource guarding or a serious medical issue where the dog has to have surgery. So this is a very high level sort of view of common behavioural issues. To be honest with you, each topic could be, its own in its own right. And I do have separate blogs and podcasts on separation anxiety and aggressive and fear-based behaviour, and I have nutrition ones that are available as well, but there's one other thing that's popped into my head as well, and that is fears and phobias. And I know I've already talked at length about like aggression and fear and anxiety and stuff, but this one in particular I get called out about as well is fear of certain sounds. I think, noises or sights or what we call stimuli. So like your fireworks, your thunderstorms, loud noises. Sometimes it can be cars or inanimate objects. And a lot of it falls down into kind of like sound sensitivity. Although I have seen it where, it has been like just simple movements as well, particular types of cars and so on and so forth. And I think a lot of people are familiar with dogs being afraid of fireworks, again, thunderstorms, loud noises, but fear and phobias also that are linked can also be linked to the separation related behaviours that we talked before, and also aggressive behaviours, but they kind of sit in this wider picture of like fear, stress, anxiety, hyperreactivity, and I say there's a larger avoidance. So some dogs might go and hide. They could tremble. They could pant. Breathing heavily. They might pace, bark, howl, try and escape. Just become a little shut down, or like clinging like that Velcro dog, or refuse to go outside. And they can be big and small reactions. And every dog is different in this situation when it comes to fear and phobias, because phobias, we sort of term phobias as, unlike your general worries or your mild fears, a phobia feels a lot more intense and presents very differently. So specific phobias like thunderstorms, or like fireworks, can really escalate without support and behavioral modification. And this is not something that can be resolved simply by just waiting for the dog to get used to it or get over it. I've recently worked with, I say recently, in the last couple of years. It's an Irish recently with a client whose dog was terrified of a crow banger. Now, a crow banger is basically used to scare crows off farmers' fields when but the seeds have been put down, and it makes a big bang noise. It actually sounds like a cannon going off. They're awful. I really hate them. It's quite seasonal. But for some dogs can be obviously more affected by others. Now, in this case, the dog had become so frightened that wouldn't leave the house, would cower, howl, cry, hid underneath, and last for days and weeks at a time. And it was really overwhelming for the owner. It was really upsetting for the owner. And it wasn't something that we wanted to tackle. Now, this was very slow and careful planned behaviour modification with support from the vet, because this dog did have arthritis, and we do know that there's a link between sound phobia and some musculoskeletal issues like arthritis, so that we could medicate that, but also do a tailored plan that started well before the crow bangers began their, annual routine. So that when they started, we'd already put in place a lot of scaffolding to help him. But it didn't happen overnight. It did take preparation and management, multiple sessions, and setting them up for success before the season started again. So fears and phobias are a much longer, more complicated, piece of the puzzle. So that's why, initially not had it on this list, because it is quite complicated. But it is really, really important to, get an expert clinical behaviourist, or a proper canine behaviourist to investigate fears and phobias, because they often are a lot more complex. So now I kind of want to talk about the why, because again, this is a question I get asked a lot, pretty much every single case. Why is this behaviour happening? And I totally get why people ask that. And there's usually two reasons why the owners want to know why. And they're not always the same reason that I want to know why from a behavioural assessment perspective. But the first reason is that people want to know what caused the problem, right? And we talk about the blame aspect at the very start of this. So they want to make sure that it never happens again, and they want to know the why, because they're worried that, again, they were part of the problem, and they want to make sure that they don't repeat it. So I say, it goes back to what I said at the start, people often feel like they're to blame. They feel like they've done something wrong. If they'd missed something, then it wouldn't have happened. They want to know why caused the behaviour, or if they made it worse. And I can tell you from my own horse, cats, dogs, if we've ever had an issue, whether it's medical or something's gone wrong, I absolutely blame myself too. So, it is really normal. And I also want to know why. Why did this happen? What did I miss? What could I have done differently? And how do I make sure that I don't make that same mistake again? And honestly, even if you had all the information in the world, you'd probably just make all sorts of different mistakes. So try not to get too hung up on all of that, because you can have all the knowledge in the world, and I have quite a lot of both knowledge and expertise, and I can still make mistakes with my own animals. We all do it. And then what we do is we beat ourselves up, and we wish we knew more. We wish we know it sooner, and wish we'd done something differently. But that does not mean the problem is your fault. The second reason people want to know why is because that's also how our human brains work. We like answers. We like explanations. We like to understand why something has happened. And if any of you were like me in maths class in primary or secondary school, I always wanted to know why certain rules applied in algebra. Like, I constantly annoyed my maths teacher going like, why do we do that this way? Why does that work? Why? And I never really accepted the answer of, you know, well, that's just the way it's done. You know, I hated that. I had to know the ins and the outs. So as humans, we naturally try and understand a problem by asking why. And it is a really important question. But here's my big but. When it comes to behavior, why did this happen is almost the most, isn't nearly, it's not always the most useful question on its own. It's usually not the one thing I'm going in and asking. When I'm doing an assessment, there are parts of why that's important. Like if a dog is in pain, or fearful or anxious or overstimulated or frustrated or their needs aren't being met, we do absolutely need to investigate. But the question I'm often more interested in is what factors are maintaining the behavior now, not the why, because it's not as useful as you think it is, but what is maintaining the behavior is more useful. So think about it from this perspective. If we have a dog with arthritis and as a result the dog is snapping and biting and doesn't want to be touched, if we sit there and say like, well, we can go, okay, well, why is he snapping and biting? Oh, he has arthritis. But then if we go, why again? Why does he have arthritis? Well, there's a genetic disposition, it's the type of breed he is. We did a lot of exercise when he was younger. Now he's getting older. Why is not helpful there? But if I approach it from the dog is snapping and biting, what factors are maintaining the behavior now? He doesn't want to be touched and handled. He's got arthritis. Okay, what's maintaining the pain for the arthritis? Okay, we need to medicate, we need to put rugs down. It gives you a better framework for being able to support the dog. It's a slightly different question and it really does give us a better treatment plan. If we only ask why a behaviour started, we may end up with an answer that doesn't help us support the dog in front of us. We might say, as I say, it's genetics. It's because of early socialization. It's because of a bad experience when they're younger. Okay, we have the why now, even if that was correct. But those things may all be relevant to the dog, but they're not on their own. They don't necessarily tell us what to do next. So if we ask what's maintaining the behavior, then we start look at the current picture. What's keeping the behavior going? What's the dog learning? What are they avoiding? What are they gaining? What emotions are involved? Is there pain? Is there stress? Is there fear? Like, are their needs being met? Is the environment making this worse and maintaining it that way? Are we accidentally reinforcing it and maintaining it that way? And critically again, is there a medical issue that hasn't been addressed that's maintaining it? And that gives us more useful information. And also, notice how none of those questions are like, is it me? Am I the problem? We're not, again, going, did you cause this? It's like, no, something is maintaining it. And many behavioural issues stem from lots of different factors. Like, as I say, I know I talked about genetics, environment, pain, all the other bits and pieces. But if we focus too narrowly on one why, we might, miss the picture. So like, if we say a dog's behaviour is just genetics, that doesn't give us a useful plan. I sometimes see this with like brachycephalic dogs, like bulldogs. So that's or pugs, they have that shorter muzzle. So we call it brachycephalic breeds. And, if we have issues where they're struggling to breathe or communicate with the dogs because they're missing a lot of key muscles in their mouth that they would normally communicate with another dog, or they can't run as fast or they get out of breath, then we kind of shrug and go, oh, it's just their genetics or it's just their conformation. But these dogs could still have real dental issues, breathing issues, skin issues, pain and discomfort that affects their behaviour. If we just stop at it's genetics, then we miss all the ways that we could actually support them through, good dental hygiene, being able to, give them more support, moving, teaching them things. And I get that people really want a way to be able to say this happened because of that. But in reality, there's sometimes several things happening at once. It's one of the reasons it's so important to look at the whole picture of the dog. Dogs are intelligent, beautiful animals, and they do need appropriate mental and physical stimulation. Without enough activity and enrichment and outlets for normal behaviour, they can get bored, they get frustrated, they become destructive, barking, all the problems I've discussed. But if the whole answer is they're acting out because they're not getting exercised enough, then we increase the walks. Without looking any deeper, we can actually make the problem worse. So again, if we have an arthritic dog, a dog with hip dysplasia, luxating patella, and then we think that the problem of the destruction is just that they're not being stimulated enough, we start exercising more, it's not going to solve the problem, because we could actually exacerbate it because they've got something physical going on. So yes, while they need that mental stimulation, it might actually be more appropriate to do it in a quieter, simpler way. So it's really important to make sure that we actually figure out what's maintaining the behaviour and not just make assumptions based on that one why. So that why behaviour needs to really be viewed from a holistic perspective. We do not just want to know why something started. We want to understand what's maintaining it, what the dog is experiencing now, and what changes will genuinely help. So the other question I get a lot as well is, how do I support my dog? And if you've gotten this far, you're looking for support. So with all due respect, the chances are if you're here, it's because it's a behavioural issue and you need support. And, please do contact me, reach out, or have a look through some of the other materials I have available. There's blogs and, there's podcasts as well. And you can see if I'm the right person for you. And if I'm not the right person for you, please do find someone, who has the appropriate credentials and ethos that fits with the way that you want to support your dog. I often say to people, when you're choosing a behaviour trainer, you are allowed to ask questions. Like, absolutely, what methods are you using? Ask how those methods work. Ask why they work. Ask, more than once if you need to. A good behaviour trainer will always be happy to explain the rationale behind what they do. They will be able to explain why they use ethical methods, just like I have today, how those methods support your dog, why we shouldn't use adversive methods, and they should be able to explain a plan moving forward and give realistic timeframes. If someone's not willing to answer your questions or makes you feel like you've done something wrong, or you feel it in your gut, just walk away. You do not have to hand your dog over to an approach that makes you feel uncomfortable. And if you do find someone who's like that and they've made you feel uncomfortable, you can say stop and walk away at any time. You do not need to continue with that training. We know from the research that using compassionate science-based methods not only improves behaviour but also supports the relationship between your dog. Most people don't just want the behaviour to stop. They want to understand their dog, feel safe again, enjoy being around their dog again, and build a nice relationship with them. One of the key techniques that I use is positive reinforcement, which is a component of learning theory. And positive reinforcement focuses on rewarding the behaviours that we want to see repeated, rather than shutting down dogs by stopping behaviours that we don't want. So we teach them what we'd like them to do instead of making, behaviours more, less likely to happen. We encourage the behaviours that we do want. That doesn't mean we ignore serious behaviour, by the way, and letting dogs do whatever they want. It's a form of training that promotes positive, outcomes and supports the behaviour that we do want. The research is very consistent that dogs trained with positive reinforcement are more likely to develop behaviours that we want to see and are less likely to show fear and anxiety linked to training. Because I work clinically, I'm a clinical behaviourist, my assessments always, go beyond just the training and the behavioural assessment. I do look at the whole dog. I look at their movements. If there's any musculoskeletal issues, I work with your vet. I provide gait analysis. I look at how the dog sits, moves, stands, turns, and their body, and if there's anything there, as well as the nutrition and the gastrointestinal health, any signs that the dog's body might not be coping, particularly if it's anything like resource guarding, separation related behaviours, the pica, the coprophagy, the skin issues, everything that I talked about today. And supporting behaviour is not just about walking your dog more and doing more obedience training. Dogs need appropriate physical activity, but they also need mental stimulation and enrichment, as well as good resting places and outlets for natural behaviour. So the right kind of enrichment can really help prevent and reduce a lot of behavioural problems, but it needs to be realistic for the person as well as being helpful for the dog, because not everybody has the time, energy or capacity to set up an elaborate puzzle feeder or interactive, toys or anything like that, and that's okay. And it's my job to tailor things for the individual dog and the individual household. And there are lots of ways to keep dogs engaged and meeting their needs and supporting their well-being, without having to try and make life more complicated. And when I'm working with fear and anxiety or phobias, I always use ethical techniques such as systematic desensitization and counter conditioning, which are highly effective and, evidence-informed approaches for helping your dog. So systematic desensitization involves gradually exposing a dog to something that they find difficult in a controlled and careful way without flooding them or pushing them over a threshold. And we start at a level that the dog is comfortable and can cope with, and then we slowly increase the challenge. Counter conditioning, on the other hand, is when we pair the presence of a trigger with something positive. So we want to counter the previous conditioning. And we're trying to change the dog's emotional response. And systematic desensitization and counter conditioning tend to go, hand in hand. And we often use them, together. And the goal is not to force the dog to get over it. The goal is to help them feel safer, and to build more appropriate responses over time. As I said before, because I'm a clinical animal behaviourist, I do primarily work on veterinary referral. And, I have a good working relationship with vets, because that's very important as part of my approach to protect the welfare and the interests of the dog. It's also important that a lot of behavioural issues are tied up in medical issues. And if we suspect pain or discomfort, the worst thing we can do is to try and just train through it. It's not fair on the dog, and it's not likely to give us any kind of lasting results. And in those cases, I will support my clients with communicating directly to the vet, because I can explain what I'm seeing and, raise any concerns and be able to speak to the vets in a language that they understand. And, that takes a lot of the pressure and then, the noise and the confusion away from the owner, especially when people are really stressed anyway about something that's going on. So for me, just to sign off, I really do understand how challenging behavioural issues can be. I don't want you to face them alone, and I don't want you to feel like you're to blame for them. This may be your very first behavioural problem that you've had. I hear this all the time from clients. They say, I've had dogs my whole life and this has never happened before. But I would say that this is not my first time seeing it. And this is what I do. I really do specialise in compassionate science-based methods, that look at the real root cause of the dog's behaviour and support the whole dog, trying to create things for lasting change. My aim is not just to stop the behaviour, but my aim is to understand what's happening, support you and your dog properly, reduce the stress for everyone, and then just help you build that relationship that you want with your dog. I hope you enjoyed the podcast today. Guys, if you have any questions, you're more than welcome to WhatsApp me or email me if there's a topic that you want me to cover, either on a blog or a podcast. I'm always open to hear what you would like. So until next time, have a lovely day, or enjoy the rest of your day, or the start of your day, whichever way it's happening. All the best. Bye. Thank you so much for listening. If you would like to send me a question, you can either email me or WhatsApp me. And if you want your question answered on the podcast, why not even send me a voice note? If you liked or enjoyed this episode, please do rate and subscribe so you never miss an episode. Hell, even share it with someone you think might enjoy it too.